Hey guys, 5 days ago I did a update on the coronavirus and COVID-19, and this was a live stream Instagram. Today I wanted to bring you an actual YouTube of that sort of short seminar, bringing you updates that have elapsed in the last 5 days. This is my Instagram handle if you want to follow this regularly. For now, I figured we'll go ahead and put this online. You can help circulate it, and I'll try to do weekly updates. So this is where we were last, basically Thursday morning, just 5 days ago, March 25th. This is what the sort of COVID-19 pandemic looked like globally. United States, China having the highest case reports. Fast forwarding just 5 days, the global picture now looks like this. We're basically seeing an increase in case reports throughout the world. Not so shocking given that we are in a pandemic. Early phases of one at that. These are the numbers. If you look at the globe, you'll see that we had about 490,000 cases of COVID-19 just 5 days ago, about 22,000 deaths. Globally, if you looked at the sort of rough percentage, look at the case fatality rate, you calculate about 4.5% mortality using these sort of rough numbers. We'll look closer to it, the United States. We had 69,000 cases last 5 days ago, about 1,000 deaths. Rough sort of case fatality rate was 1.5%. Let's fast forward now to today's numbers. This is just 5 days later. We're looking at the United States now top in terms of case reports globally. The highest number of cases in the world are in the United States, and we have about 700,000 cases globally, 37,000 deaths. 160,000 cases in the United States, and the mortality has jumped up about threefold to now 2,900 deaths. That's a lot of numbers. Case fatality rates have remained pretty similar, about 4.5% globally, 1.8% in the United States. Here's a quick highlight of these numbers. Again, a 5-day period, 25th to March 30th, globally, case reports have grown from 491,000 cases to 700,077 and some. In the United States, grown from 69,000 to about 160,000 in just 5 days. That's a dramatic increase in case reports. In fact, globally, it's a 58% increase, and in the United States, it's over double of where we were just 5 days ago, 130% increase in case reports. So just another testament to why we need to take this virus seriously and how quickly these numbers can change. In 2014, I followed the Ebola outbreak very closely, and in late summer when this outbreak was really getting going, I actually took World Health Organization data and plotted cases and mortality over time. And what I did was I basically extrapolated that curve to try to estimate what mortality and case reports were going to look like 2 months from there. And just by extrapolating those, I predicted those numbers quite accurately if we fast forwarded to the end of October. And that's basically what happens in the early stages of an infectious disease without measures of, isolation and travel restriction. You can basically assume that an exponential growth in that virus is going to take place. And this is pretty similar to what we're seeing globally right now with the COVID-19 outbreak. A pretty exponential looking curve. Again, not totally shocking because this is how infectious diseases work. When they're communicable from person to person, you can get very rapid increases in case reports, and that is certainly what it's looking like today. I want to show you where the United States has come in the last 5 days since we talked last. This is case reports nationally. Fast forwarding to March 30th, we see basically a darkening of the entire country. Places like New York, California, Michigan really are sort of epicenters for COVID-19. However, it's worth noting that New York, about 60,000 cases, far higher than the second and third sort of highest states, being California, New Jersey. New Jersey's looking at about 15,000 cases, California around 6,000. So really 10 times more cases in New York compared to a state like California, but all three of those states are really sort of leading right now. Let's take a look at what the New York Times has shared, which this was as of March 25th. You see places like Los Angeles, San Francisco, New Orleans, Miami, New York City really as the hot spots nationally. Fast forwarding 5 days, those areas remain hot spots, but basically the sort of size of all these circles around the whole country has grown because basically the numbers of cases in all these different areas are growing, but we still see our sort of regional epicenters remaining the same. Just another expectation, of course, as we move forward in this infectious disease outbreak. That's a combination of more infection, but also of increased reporting. As you've probably heard, there were lots of issues with getting testing kits deployed regionally. So as we get more tests, we're going to start seeing those cases bump up, partially due to just higher reporting. But of course, also because the virus is spreading as infectious diseases do. This is what new coronavirus cases announced per day looked like. This is what I showed you on Thursday morning. This was taking us to March 25th. But we've got more data in the last 5 days. This actually takes you to March 29th. We've seen daily reporting basically going up. So the numbers of COVID cases growing substantially. I also showed numbers of what it's like in California. California is where I'm from. It's also where a lot of you who I know are following my Instagram and YouTube where you're from. So let's take a look at California. We've shared last week, March 25th, cases in Los Angeles, about 800. Orange County, only about 187. Well, not surprisingly, these numbers have all grown. Let's take a look. Los Angeles now over about triple where it was just 5 days ago. Orange County, we're here at 464 deaths, up from 187. So we're basically seeing multiples as we move forward, just a matter of a few days. Orange County, sort of San Francisco area, Los Angeles, these major population centers are where the outbreak is highest in the United States. Again, that's not going to be totally surprising given that's where most of our people are. Population density is also high in these areas. But this is just real-time data changing constantly, so much to follow. Wanted to bring these numbers back to you. I talked a bit about mortality rate, and I think that's a question that a lot of people are concerned about, right? What is the mortality associated with COVID-19? It's really important to understand that while we have a good idea and an idea that's getting better as to what the case fatality rate is, this number is going to change, and we're basically going to learn more and more about how lethal this virus is over time. But we're honing in on about a 2% mortality rate, and that's the number that's sort of been floating around. But I think that it's very important to understand that that 2% is also an average. So if you're an older population, you're going to see a higher mortality rate in that older population than the younger population because COVID-19 is more detrimental to elderly people. Let's take a look at 2 studies that are helping to give us an idea as to what the case mortality rate is. This is looking at a population of about 1,600 people in Italy as of March 17th, and then we'll also take a look at a population of about 1,000 people in China, which was as of February 11th. So these mortality rates are quite different if you look at the age of the population of interest. If you're over 80 years old, mortality rate was between 20% and 15 or 14% between these populations, way higher than the 2% that we often hear about. In fact, in the case of Italy, we're talking about a 10 times higher mortality rate among this older age group. Of importance, if you're in your 60s, 70s, or 80s, basically the case fatality rate is much higher than 2%, ranging from about 3.5% all the way up to the 20%. So case fatality rate, really high among elderly, gets higher as you get older into older populations. There's a little bit of good news in this analysis. That is, these studies show that virtually no people have died at least in these populations that were under the age of 9, and very few under the age of 19 and even 29. So the younger age groups are showing greater resistance in terms of mortality as it relates to COVID-19. So that's a bit of good news, but it's very important even for those age groups, myself included, to take precautionary measures, employ social distancing, and don't go hanging around with large groups of people, because we are of course a global community and we don't want to see the hospitals, as I'll talk about, get too crowded as they already are. So let's talk about this case fatality rate looking across the sort of spectrum of different countries. Again, as I said, there's no sort of single number that we can really pull out because the case fatality rate is going to differ by different populations, different areas, different age groups. This is looking at a variety of different countries and what the mortality rate is in those different countries. If you look at Italy up in the top left, they saw fatality rates of up to 10%. Now, places like South Korea in the under 2% range. United States, again, around the 2% range. But there's a wide variety of percentages that you'll find if you look at different countries. Now, why are we seeing such variability? Again, it depends on the age of the population, the health of the population of interest. If you're in South Korea, well, we've seen a lot of young people get infected in South Korea, so seeing a lower mortality rate in South Korea is going to be somewhat expected, given that younger people are more resistant to the adverse impacts of this. And quite the contrary in a place like Italy, where there's a higher elderly population, case fatality rate extremely high. This is just another testament to how that number is no single number. It's going to be sort of differing depending on which country you're looking at, and what we're trying to do is just get a best idea as to what the mortality rate is globally and nationally. I want to talk a little bit about the Spanish flu because we're starting to hear comparisons. We're starting to hear comparisons between COVID-19 pandemic and the Spanish flu of 1918. So let's talk about those and make some comparisons and contrasts. The Spanish flu infected about 500 million people globally, about a third of the global population at the time. 200 to 50 million deaths are presumed to have been attributed to the Spanish flu, and about 675,000 Americans had died. The case fatality rate was about 2.5%. Now, quite interestingly, that's similar to what we're seeing with COVID-19. The case fatality rate is in that 2-3% range. So in that respect, we're talking about pretty similar situations here. Some other comparisons to be made. What makes this different, COVID-19 versus the Spanish flu nearly 100 years ago? Well, today we've got 7 billion people as opposed to 1.5 billion people. We've also got air travel linking corners around the world. This is why it's been so important to restrict air travel during this pandemic. And we've also got global supply chains, an older population, as public health has improved. Our population on average is aging, getting into their older years. But of course, with coronavirus, we are seeing elderly populations more affected, so that can of course influence the mortality that we see, given that we are an older global population. Now, a good thing when we talk about the differences here is that the Spanish flu was occurring during World War I, during the wartime. It was much harder to place travel restrictions and social distancing protocols at that time. Today, we're not in a wartime, a global war. We actually can and have employed these different precautionary measures to a greater extent. So that is, of course, going to help us to combat the virus and to help us slow down the progression of this virus and disease across the world. We're also hearing COVID-19 be compared to the seasonal flu. You might have heard the seasonal flu in the United States has killed 23,000 people already this year. That's far higher than what we've seen with COVID-19. So why are we so concerned about COVID-19? Well, let's draw up the numbers and talk about how these are different. And one of the most important things to note from the outset is that COVID-19 is just in its infancy in terms of its duration, its sort of outbreak timeline. So let's look at some flu facts. On average, about 8% of the nation gets infected with the flu per year. The mortality rate for the seasonal flu is about 0.1%. So let's look at the seasonal flu using these numbers. We have a population in the United States of about 327 million people. If we multiply the 8% that usually gets infected with a mortality rate of 0.1%, we come to about 26,000 deaths annually from the seasonal flu. And using those numbers in our population today, that actually puts you pretty close to the 23,000 people who have already died this year from the flu. And we're not totally done with the flu season, so we can actually say that expect that this number might grow, and it's pretty similar to that 26,000. Now with COVID-19, let's take the same 327 million people, apply the same assumption of an 8% infection rate, and also take the mortality into play here. 2% mortality rate with COVID-19 compared to the 0.1% mortality rate with the flu. So we have a 20 times higher mortality rate. So just running these numbers, we're of course going to have 20 times higher death in the country from COVID-19 if we assume a modest infection rate of just 8%. So already we are 500,000 people dead if we take this assumption. But keep in mind when we talk about this 8% infection rate, that 35 to 45% of the United States is vaccinated for the seasonal flu. With COVID-19, we don't have a vaccine, so that's an important difference right there. So when we talk about the infection rate, let's assume 16% of the country gets this virus. We're already at 1 million deaths in the country. There are some estimates of over 2 million deaths that we'll see by the end of this outbreak. So when we look at the seasonal flu, really in its infancy, we have a vaccine, a much lower mortality rate, probably a much lower infection rate. All these things combined, the COVID-19 outbreak is of paramount concern and far exceeds what we would really see seasonally from the flu. So that's just a really important distinction between these two. So let's talk about the infection rate. How contagious is COVID-19? There's this value called the R0, which scientists use to measure and estimate how infectious a virus is. So what it basically says is if you've got someone infected with a virus, how many others will get infected from that same person? Well, let's look at the seasonal flu. This has an R0 of about 1.3. What that means is for about every 3 people who get the virus, you can expect 1 more person to get it from that group of 3. Talk about COVID-19, of course, we're still trying to understand this, but early estimates are that the R0 value for COVID-19 is somewhere between 2 and 3. And what that basically means is for every 1 person who gets the virus, 2 to 3 others will get it, or to equate it with the flu, as I just mentioned, for every 3 people who get the virus, you can expect 6 or 9 people to get it as opposed to just 1 extra person. So another important thing to keep in mind is when we talk about COVID-19, it's not just about mortality. So we shouldn't just be concerned about the mortality rate. There are some studies out of China that have shown us what the sort of morbidity looks like with respect to COVID-19. About 81% of people who got the virus under one population of 44,000 that were looked at, 81% of people showed mild symptoms. 15% roughly showed severe symptoms, with about 5% showing critical condition. So again, you might be, looking at mortality rate and think, oh, there's only a 2% chance of mortality, but there's a 15 to 20% chance of either being in severe or critical condition. So nobody wants to be subjected to those types of ailments and that degree of sickness. So please do keep in mind. So that's really something that's important to keep in mind when we think about how COVID-19 may or may not affect ourselves or our families. There were another 4,000 people that were looked at in the United States. Of course, this is still happening so quickly in the United States, but looking at about 4,200 people, we saw that 12% of those individuals who were infected were admitted to the hospital. So again, that's pretty pretty high number, much higher than the mortality rate, and nobody wants to be hospitalized. Comparing that to the flu, we only typically see about 1% of the population who is infected with the flu ever become hospitalized from the flu. So we're talking about a 10 times higher hospitalization rate with COVID-19 compared to the flu. I actually extracted some CDC data in the United States to try to put some graphs together for you to understand how cases differ by age group. And this is basically what you see as of this week with the data that we have. About 25-30% of people who are testing positive for COVID-19 are in that 20 to 44 age range. And you can basically see the whole middle-aged population, of course, not surprisingly, is who's presenting mostly with this virus. Looking at hospitalizations, you see also 20% of hospitalizations are among the 20 to 44 age group, and similar amounts, similar magnitudes of hospitalizations among these other age groups. 65 to 84 age group showing the highest hospitalization currently. And what about critical care? So people who are admitted to the intensive care unit, primarily people between 65 and 84 years old, but there still are people, 10% of people admitted to the ICU are actually 12% roughly, are between 20 and 44 years of age. Just another reason we all do need to take precaution when we think about this virus and its impacts. Hospitals, importantly, are getting overrun, as you've probably heard in the news. There are basically not enough beds, not enough ventilators for people who are getting admitted to the hospital. There are not enough masks for nurses. So all of these sort of shortcomings of resources place immense pressures on the healthcare system, both in the United States and globally, which make it difficult to treat patients adequately. Not only may some patients not have the care they need in terms of the ventilators or beds, but you're also going to have your medical personnel on the front lines of help and healthcare get infected and be taken off the front lines. So we have short supplies of medical staff because potentially they're not getting the masks they need, or other reasons that are basically being worked in these conditions that aren't really ideal for handling this many people with an infectious disease. So that's one of the main concerns right now, is that we're going to basically increasingly flood our healthcare system, and when you flood your healthcare system, your mortality rate can go up quite a bit. If we look at the case fatality rate in Wuhan, China, it was about, and that was the real epicenter of the disease at first, the case fatality rate there was about 5.8%, which is quite higher than if we looked at other areas of China, about 0.7%. Why such a difference from place to place in China? Well, this again gets back to the importance of not overburdening your healthcare system. In Wuhan, China, the healthcare system was overpressurized with people coming to the hospitals with this infection, and when you can't keep up with the infection rate, when you can't keep up with all the individuals getting sick, again, mortality rate is going to go up. So we don't want to see that happen in the United States or anywhere. So that's the main concern right now, I would say, with the COVID-19 outbreak. So you've heard a lot about trying to flatten the curve. We might have the same amount of infections at the end, but if we can sort of flatten this curve so that at any given week or month, there are fewer people getting admitted to the hospitals compared to sort of just all-out outbreak scenario, then we can actually help the healthcare system handle this outbreak and not see as high a mortality rate as we might otherwise see if we don't, employ social distancing and travel restrictions and so on and so forth. This is just a schematic that you can find on the internet showing how different scenarios of the outbreak can translate to different degrees of being overburdened in hospitals by the COVID-19 outbreak. So symptoms, how do you know if you have COVID-19? Well, if you develop any of these warning signs such as trouble breathing, persistent pain or pressure in the chest, new confusion, bluish lips or face, Loss of smell actually has been a symptom which is more recently reported. The smell does return, sense of smell does return after infection and recovery. Importantly, anyone, any age group with pre-existing conditions having to do with heart or lung disease or diabetes is at a higher risk if they get infected. So important to keep that in mind. So how do you stay protected? Take steps to employ really good sanitation and hygiene. Clean your hands. Soap and water is actually the best way to combat this virus if it's on a surface or if it's on your hands. So wash your hands, keep your surfaces clean. Of course, maintain that social distancing etiquette for the time being. Don't be within 6 feet of a person. Don't go to crowded places. Try to stay in your home if you can. And if you go out to take a walk, don't go to areas where lots of other people are walking. Try to keep your distance from people. This is a very infectious disease, as I showed you, much more infectious than the flu, and you want to keep yourself and your family healthy. If you do go to the store and you're shopping, buying things from the grocery store, and touching lots of products, try to keep your hands away from your mouth and your eyes and your nose until you can get back to your car, use some hand sanitizer, and clean up. When will symptoms occur if you do get infected? This is a nice table that shows you differences between COVID-19 and the flu and the cold, the common cold. One thing you'll notice is that body aches are quite common with the flu, whereas they're only sometimes common with COVID-19 patients. So if you have body aches, it's an indication that you may have the flu rather than COVID-19, but there's other things you should look at too. Shortness of breath is something that's common with COVID-19 as opposed to the flu. Another key difference is respiratory issues are more common with COVID-19 compared with the flu. Now, what about the cold? Really easy way to tell if you've got a temperature, you've probably not got a cold because having a temperature is rare with the common cold. So these are just some ways you can try to help identify whether and which virus you might have if you are ill. Importantly, the onset of symptoms ranges quite dramatically between these different viruses. If you've got the common cold, you'll present symptoms within 1 to 3 days. COVID-19, 1 to 14 days. So quite a higher latency period, at least at the upper end there. Now, a lot of people ask, how long does COVID-19 last on surfaces? Well, again, we can only tell you what we know at this time, but it's looking like about hours to days, a few hours to a few days, and it depends on the temperature, the relative humidity, exposure to sunlight, and so on and so forth. So something to keep in mind if you do get a package in the mail and you're worried about who might have touched and handled the package, one thing you might consider doing is just taking the package and setting it aside for a couple of days and then coming to open the package later if you really just don't want to worry too much about who may have touched it and so on and so forth. Now, there's also a lot of questions about asymptomatic carriers. Can I go around my grandparents? I haven't had symptoms and I've been quarantined for, a couple of weeks. I've only really gone to the grocery stores. I haven't really been out too much. Well, it's really important to keep in mind that early studies so far, there's only about 2 main studies that I've seen showing that the asymptomatic carrier can be upwards of 15 to even 30% of the infected population. So 15 to 30% of the population may be infected and never show symptoms, but still potentially be contagious. So again, I just always think it's better to be on the safe side if you've got elderly family members. Just think about the potential that you're an asymptomatic carrier. Really try to stay as distant from people right now as you can, especially that more vulnerable population. How about masks? We've been seeing a lot of people wearing face masks. Are they effective? Are they not effective? Quick answer, they're not effective if you're somebody who's healthy and worried about getting the virus. If you're a nurse or a healthcare practitioner and you're working with infected patients, one thing that masks can help you do is prevent hand-to-mouth contact. So if you've got some contaminated surface with COVID-19, it'll help to have a mask on to prevent you from contacting your own, what they call the T-zone, and that way you can help prevent transmission. Another reason you might wear a mask, if you are an infected person and you are sick, then the mask can actually help to prevent aerosols from getting out of your respiratory system and infecting others. If you sneeze, that mask of course is going to be helpful to retain some of those droplets and keep other people around you healthy. But again, if you're a person that's healthy, wearing this is not going to be very effective, and better to leave those masks, let those masks go to people who really need them, people who are either sick or people who are on the front lines trying to cure and treat infected people. So just something to keep in mind. And this, by the way, is not just me, it's also consistent with CDC and WHO guidelines. During this time, I do want to mention that psychological health is so important. Take breaks from the news every once in a while. Take care of your body. Go on exercise, do push-ups, sit-ups. Keep your body healthy. Eat right. Eating is so important to one's health. Meditate, read a book, pick up some hobbies that you can do that don't require social interaction during this time. There's actually a lot of live concerts that people are doing online through Instagram, which is actually really neat because they're live concerts. So check out your favorite artists on Instagram and see if they're doing a live concert. And just connect with others. Give a phone call to those relatives you haven't talked with for a while. There's an app called House Party where you can actually talk with friends and you can see all their faces. You can even play games on this app. It's a really neat tool where you can interact with your friends, your family, your relatives, and you actually feel like you're hanging out. I've actually done it a couple times and it's really neat, so I encourage you to check that out. Be sure to learn more on the CDC or WHO website, and visit my website, shahirmasri.com, if you want to stay up to date with both the coronavirus and environmental health and public health and climate change and all sorts of other topics I carry. Be sure to subscribe to my YouTube channel and check back with my Instagram at dr.shahirmasri. That's where I'll be posting regular updates about coronavirus and other issues. You can also subscribe to my newsletter by going to my website. Hey, thanks everybody for tuning in. Stay healthy.